Hi everyone, my name is Lauren Frazier, and today I'm going to present to you my definition of ethics. So I'm currently a nursing student here at Delaware Technical and Community College, Terry campus. And taking this course has really made me realize and really come to the conclusion of what ethics is and how much it affects the medical field. So when I hear the word ethics, I think of it as such a broad topic. Ethics is so huge that when defining it, there's so many different dynamics that come along with the topic. There are a lot of different ways to specifically describe the topic. A few examples that have impacted me throughout this course so far, being in the medical field. One of the ethic topics being normative ethics. It is the study of principles, rules, and theories that guide actions. So example, when working in the hospital, there are many consequences that us doctors, nurses, techs, any healthcare provider have to face when dealing with patients and their families. As you know, in the healthcare field, HIPAA plays a huge role as far as, patient confidentiality and, just between all the information regarding the patient, discussing medications, procedures, the process of their health, the progression of their health. So HIPAA plays a huge role. And basically, there are consequences, there are rules when it comes to discussing patient confidentiality, patient information, anything regarding the patient. There's a huge normative ethics, okay? Another huge example playing in ethics, that plays in ethics that relates to the health field, is morality. I feel like it's more of an example of philosophy referring to the beliefs concerning right and wrong, good and bad. Morality does have effect in the healthcare system because there are plenty of times when we ask ourselves, in certain situations, are we doing good for the patient or are we doing bad? Is that the right thing to do? Is that the wrong thing to do? So of course, we come across these situations with morality when, a patient may have a procedure done. Say they have a surgery. Is that surgery really going to help them or is it going to make them worse down the road? As far as, regarding their health. Same thing, with certain medicines. We ask ourselves, is this medicine really going to help cure the patient's illness? Are there any, what are the good, what are the bad effects of the medication? In the long run, will it give them different complications than what they're actually facing now? So a little as far as going through this course, understanding ethics, it definitely plays a huge role in my career choice, which is nursing, because ethics is all throughout the health field. The different elements of ethics, such as descriptive ethics, being the scientific beliefs and practices. So there are certain, ways that doctors, nurses, there's certain practices that they believe in, which they follow through with. Applied ethics, focusing on the application of morals, norms to specific moral issues or cases. This is huge in the medical field. There are certain cases that we may come across, and our co-workers, such as case management, they handle those situations. As far as, will this patient go straight home from the hospital or will they have to go to a rehabilitation center? Will they need hospice care? Will they need home care? It's all based on how the case management level handles that. And I feel like that's definitely applied ethics because they are handling those certain situations as far as, issues or cases that patient may have. And even, once again, normative ethics, being the study of principles, rules, and or theories guiding our actions and judgments, which are used and discussed on a daily basis in medicine. Throughout this course, I have learned so much so far, and it's only been 4 weeks. The different applications of ethics, the Socratic method, back to the whole discussion with Plato, and that scene, that being the method of questioning, ways to find the truth. So, you ask yourself in certain situations in the hospital, are we doing this right? Is that person doing this right? But how are you going to know unless, you find out the correct information? You want to know, okay, so that person's doing this procedure, that doctor's doing this procedure, but is it really going to help? Or, say a certain patient took a medicine that, okay, Dr. K said it would work, but Nurse Lauren is like, no, I feel like that's not going to work. You have to have your own judgment. You're obviously going to have your own judgment, your own understanding of it. So sometimes, we question a lot of things in the medical field, and that goes all back to the Socratic method. Like I said, morality plays a huge role. There's certain, different arguments that can play roles in the health field. The moral theory being an exclamation of what makes an action right or wrong, makes a person good or bad. So with all this information, I feel like, again, ethics plays a huge role in the medical field, and it always will play a huge role in the medical field. There are different elements, like I gave you guys some examples, which really impacts nursing and the health field as far as, us and our patients. I hope you guys kind of got a little understanding of my understanding of ethics, and I hope everyone has a wonderful rest of the semester, and I really appreciate you listening. Bye, guys.